Doctors of Reddit, what's your thank God they came in for a second opinion moment? Psychiatrist here. A 30-year-old man with mild depressive symptoms was in and out of the hospital fairly quickly. He was under pressure from his home life, living with 4 roommates who were making life a bit difficult for him. No suicidal thoughts. He was cleared of all psychopathologies by me and 2 other doctors. A few months later he came back. Same symptoms. However, this time he talked about 5 roommates. It felt wrong, and I digged in his story. Tried to contact his roommates. He lived alone and was severely psychotic. I have no idea to this day how he hid it so well from everyone. One of my sister's friends was diagnosed with cancer at age 10. They were advised to pack up their stuff and move across the country to go to a specialist because they would have to stay there for at least a year. They even had to hire a private plane so she wouldn't get sick on the plane from any passengers. Well, before they left they got a second opinion saying it was pneumonia. Then they got a third that again said it was pneumonia. Now several years later she is healthy and never got cancer treatment and has been tested for cancer regularly. I have been diagnosed with cancer several times, but all have been wrong, thank God. Not a doctor, but the patient. Went to my family doctor with the worst headache of my entire life. She dismissed it, telling me it was a tension headache and that I should take a Tylenol and lay down in a dark room. Over the course of the next month, I saw her a total of 13 times, each time with worsening symptoms. First it was dizziness, then vomiting, then eventually I could no longer see out of my right eye. Every time she told me it was just a tension headache or a weird migraine, gave me a prescription for painkillers and sent me on my way. The final straw was when I was no longer able to walk properly. I would try to take a step, but all I could manage was this weird shuffle. She reluctantly agreed to send me to a neurologist. The next day I showed up at his office and was in there for less than a minute. He took one look in my eyes and immediately called an ambulance. Turns out I had hydrocephalus. My ventricles were 5x the size they were supposed to be, and my brain was literally being squeezed out of my head. Go figure. Eye doctor here. I had a patient I saw several months before they came in for their visit, but well less than a year, which often means something could be wrong. In this case, as it turns out, nothing was wrong with her by way of complaints. She just wanted to get updated before getting some new glasses. We decided to just run the regular gamut of tests anyway just because we might as well while she was there. She was a 50Y0 woman, fairly normal exam. Perfect vision. Retinas showed healthy, but something about her pupils really bothered me before I dilated. We chatted about it and I asked her if she banged her head or anything weird and she said no, but suddenly reveals this crazy history of an old meningioma, a type of tumorous brain growth she had removed a few years ago. She had decided to omit this from her history with us as she didn't feel it was important. But we went and put it into the charts anyway. Turns out she got a CT done 2 weeks prior to her exam with me, which she says turns up completely normal. I tell her she should tell her doctor about this anyway just to cover our bases. Fast forward. Patient shows up in my office ecstatic to tell me that my examination revealed that her tumor had returned with an incredible vengeance. She had no idea, was totally asymptomatic, and the CT she had prior to me showed what was very literally the size of a speck of dust, which the radiologist dismissed as artifact. On her return to her doctor, they decided to rerun the CT to cover the bases, and they found a quarter-sized tumor. Within 2 weeks the tumor went from the size of a dust particle to a quarter. She was rushed into emergency surgery as the tumor was growing super fast and was close to a blood vessel which could cause a massive stroke. She had it removed that day and returned to me after recovery to tell me of what got discovered as a result of my testing. She is now a long-time regular patient I have been seeing for about 10 years. This guy was told he had pink eye. He had metal shards in his eye from welding. My dad, a pediatrician specializing in neuro issues, was seeing one of his patients at the hospital got dragged into the NICU unexpectedly by a nurse who insisted a baby wasn't well. The attending doc insisted the kid was fine and just tired from a difficult vacuum assist delivery. My dad could tell the baby wasn't okay and managed to talk the parents into a brain scan. The NICU doc insisted my dad was nuts to the parents. Dad was right, and the kid had a brain bleed and was rushed to surgery. The baby would have died without the nurse bringing my dad in and the parents listening to him. As is. That extra time almost certainly cost brain function. A nurse here had a lady in for simple pneumonia. Her 13-year-old son was getting bored, so I showed him some equipment. I connected a simple heart monitor to him and discovered he was in a complete heart block. I printed a strip and showed it to the doc. We suddenly and unexpectedly got a cardiac patient. This is some Grey's Anatomy House knew all along and used playing with the child as an excuse. All because the kid wore mismatched socks. 22-year-old guy came in after seeing his primary at another hospital. His mom was my patient and asked if I would see him. I am an internal med doc. He had told his doctor he had a headache. I did a usual full review of symptoms since he was new, and he also marked his left testicle had a lump. Did exam and he had hard small lump on testicle. Knew right away likely had metastatic testicular cancer. One stat brain scan and testicular ultrasound later confirmed it. Asked him if told other doctor about the lump and he said yes, but the other doctor told him it was normal. I think the other doctor should get his testicles checked too if he thinks lumps are normal. 1, 2, 3 lumps. All good. I had a guy come in for a second opinion after the first place didn't bother asking any medical history. Of course I took his history and asked more questions as we went. I remember telling him something felt off and we needed to run a test. So I ordered a peripheral vision test. When I got the test back I was shocked by the most classic tumor pattern I'd ever seen. 2 weeks later he was in surgery to get it removed. A month after this guy was back in my clinic thanking me. Totally different guy. Personality was a complete 180. Energetic and happy. Here's another one I thought of, though a bit more sad, but also good at the same time. Here's a cautionary tale why urgent care should never treat eye issues. Lady was referred to me after 2 weeks of treated for a red painful eye. The PA and MDs that saw her tried allergy meds and antibiotic is thinking it was allergic or bacterial conjunctivitis, or hoping it was mild viral that would resolve on its own. So I took one look at her and knew it was a herpes simplex infection in her cornea. She was in pain and had been mistreated for 2 weeks. Got her on antivirals, but after discussing how it was odd she didn't have any active herpetic sores, but had a really bad cough that the said was just pneumonia and would go away with antibiotics. I told her to get it checked with a pulmonologist because it didn't sound like pneumonia and it wasn't getting better. I saw her 3 months later to monitor her corneal appearance and she came in using a wheelchair. Turns out the pulmonologist was blown away that the had dismissed her. She had a really rare small cell lung cancer. The reason the herpes infection manifested in the first place was her immune system was compromised. She told me the pulmonologist said I'd saved her life because they caught it early. It's been a bit over a year. She's still undergoing treatment but her spirits are strong and she's optimistic, as is the pulmonologist. Dermatologist here. I have seen probably 5 instances of my other doctor told me it was fine. That were melanomas. A lot of times people don't want a full skin exams. There are lots of perfectly sane reasons for this. Time. Perceived cost. History of personal trauma. However, I routinely find cancers people don't know they have. Keep this in mind if you see a dermatologist for acne and they recommend you get in a gown. I went to my former doctor about a mole on my arm that I thought had gotten larger, and asked him to biopsy it. He looked at it carefully and told me it was fine, but I insisted and things got a little testy. But he did it. It was a malignant melanoma, and had it gone 1 millimeter deeper I'd have been grounded for 5 years from my pilot job at best, or suffered dire health consequences at worst. After a surgeon removed a big chunk of my arm excising the melanoma and surrounding tissue, he told me to be sure to thank my regular doctor for saving my life. Thafa, in the time since I've become well acquainted with your specialty as my first line of defense, having moles mapped and checked every 6 months for a while, and now every year, it sure as hell isn't all Botox and laser hair removal. This is a "I wish I had gotten a second opinion" story. I had a doctor in high school who was unconcerned when I suddenly developed vertical double vision, which was freaking out everyone in emergency, where I had gone initially and lost 60 pounds for no reason. It was only a year or 2 later when I told him that my arm would fall asleep much faster than normal when I raised it to ask a question in class that he thought there might be something wrong with me. MRI ordered. Brain tumor found. My grandmother had her hip replaced, but the hip always hurt to her. She waited a year, hoping it would go away, but it never did. She asked multiple doctors and did multiple x-rays, but doctors said the replaced hip was fine. We finally made her go to a private clinic in my hometown, and the doctor saw that the replaced hip was fine and dandy, but the bone around it looked like it was a tad bit eaten by bacteria. So the new doc did an operation, and there was so much pus in the leg it was insane. If my grandmother waited any longer, her blood would become infected and she would have died. Thank goodness she went to the clinic. Had a patient come in for therapy after his PCM yelled at him for being a hypochondriac and saying his symptoms were all in his head and that he was just trying to fish for disability. His symptoms were pretty obviously neurological, so I referred him for an MRI. To my shock, he had only ever had x-rays. Sadly, I had to tell the 19-year-old man that he had multiple sclerosis. With great satisfaction, I got to tell that PCM he done goofed and that I would be talking to our mutual chief of clinical services about the incident.